Dr. Childress. I'm a child, adolescent, and adult psychiatrist in Las Vegas. And I'm president of the Center for Psychiatry and Behavioral Medicine, and I'm on faculty at 2 medical schools. Today, I am very excited to talk about a session I'm going to be doing in a little while for ADHD medications that are currently on the market and those that hopefully soon will come onto the market. There are about 30 stimulants that are on the market these days, and it's a little bit difficult to navigate and figure out which ones people may want to use for treatment. So I'm going to talk today about some of the differences in the long-acting stimulants that are out on the market, and also about some of the non-stimulants that people may be less familiar with. I'm also going to talk about a few medication trials that were done with patients who have ADHD and give a little bit more information about that. When people are assessing ADHD, one of the things, in addition to asking about core symptoms and associated features such as executive dysfunction and emotional dysregulation, clinicians should really ask patients about sleep. I can give you a great example. If you think about somebody who's not sleeping, if you're not sleeping, what happens? You have a harder time concentrating, you may be more hyperactive, you may be more emotionally dysregulated, and the same thing happens with folks who have ADHD, and sometimes people don't even have ADHD because they've got a sleep disorder, and they may need a totally different treatment. For example, obstructive sleep apnea. Kids may have big tonsils, so if people are talking about my child snores or gasps in the middle of the night, you might want to look in their throat, take a look at their tonsils, because the first thing they're going to need is a referral for an ENT doctor. And those who have obstructive sleep apnea and have a tonsillectomy and adenoidectomy, anywhere from 2/3 to 80% will have resolution of their symptoms of ADHD-like behaviors. When I'm thinking about ADHD, I think some of the big challenges are really understanding the whole complex picture of ADHD. We're really good at picking up core symptoms, but we don't think as much about executive dysfunction and emotional dysregulation, and we don't think as much about comorbidities. And often patients are diagnosed with comorbidities and not ADHD, and they come in and I find out that ADHD is driving everything. Sometimes people who have been diagnosed with treatment-resistant depression have ADHD driving it all. Martin Katzman, who's a researcher in Canada, did a study and looked at folks who referred to his clinic. And what he found is folks that were referred for treatment-resistant depression, about 1/3 of them had undiagnosed ADHD. And the treatment for depression and ADHD aren't the same.